Another big headline, of course, Ebola, the death toll rising to over 900 people. Patients suffering from the incurable virus are begging for a serum used to treat 2 American workers who are reportedly improving. I want to bring in Dr. Devi, assistant professor at New York University School of Medicine. Devi, it's good to have you on the program.
Thank you.
How significant is this from your standpoint? Now 900 people have died.
Well, it's really concerning because of the rate of spread. That's what makes you worried the most. The fact that people are getting infected so easily and so quickly in West Africa, and it's spreading across the borders. I don't think people here necessarily are at risk, even though we brought Dr. Brantley and Ms. Wrightball here. I think so far we seem to be okay. But the fact that something's spreading so quickly, in other parts of the country is very concerning.
So what should people know about in America? I mean, obviously travel is one thing because these people have been transported on planes. Should we be worried about traveling?
I don't think so. I mean, it can't be spread through casual contact. So it's spread through bodily fluids like blood and semen. So that's actually very hard to spread. I think the reason that it's been spreading a little bit more in West Africa is because, Ebola causes hemorrhagic fever. It causes you to bleed like from your mouth, from your nose and stuff. So if you think about a normal person, if you're bleeding from your nose, you might wipe it with your tissue. If you don't have a tissue, maybe you wipe it with your hand. So then if you touch things, you get blood on different surfaces and it might spread more easily. I mean, here we're used to using hand sanitizers, alcohol swabs, all kinds of things all the time, whereas that may not be as common of a practice there. So,
what is the root of this virus?
Well, we don't know exactly. It's nature that created it, but it seems to be evolving. So there are different strains that seem to be more dangerous. So it's been around for a long time, but in the past, the reason that it's kind of dissipated, the outbreaks have stopped, is because they've been in rural areas where people just kind of were isolated to begin with. So either they recovered or they passed away, but then the epidemic would end. I mean, in this case, the biggest controversy right now, the biggest issue is that ZMapp, this new drug, this experimental drug, people are arguing about whether it should be made available to the West Africans. So, from my point of view, we don't know if it works, but I think that it is reasonable to do those studies, to actually do the research on these people, especially when it's spreading so quickly. I mean, not force them to do it, obviously, but at least give people a chance, to decide if they want to volunteer for a study and then find out more information about whether it works or not.
And we know that 2 individuals in America are improving as a result of having been given this drug.
We know they're improving. It's not totally clear if it's because of the drug. I mean, we know the drug didn't harm them because they seem to be okay. But the thing is, those 2 have had a lot of things that are different than other people. So, they're being treated at Emory. They're not being treated in West Africa. They're both healthcare providers. So when they started having symptoms, they might have done things a little bit differently. If you already have access to all kinds of medical supplies, you might rehydrate yourself. You might do a lot of things differently than the average person who's at home. So I think that, we can't tell for sure what's happening with them. But if we actually looked at West Africans, the regular people who were infected with Ebola, it would be possible to figure it out a little bit more. I mean, some of the controversy is related to the fact that, one thing is that people feel like because this drug is in limited supply, should we reserve whatever we have for Americans as opposed to West Africans? So, that's a concern. But the thing is, unless we figure out how to stop Ebola, it's going to be harmful to Americans anyway. It's going to be harmful to the entire world. So, in terms of protecting American interests, I think it still makes sense to find out if this drug works and tweak it. Maybe it just needs an adjustment in dose. Maybe other things need to be looked at. That's happened with HIV drugs in the past. And then the other controversy is, we have a dark history in this country of experimenting on minorities or the poor, for medical research. I mean, this has happened in the past. So people are concerned now you want to test an experimental drug on the Africans, is this kind of more of the same? But I think this is a little bit different because in this case, we have the potential to save lives. The fatality rate right now is between 60 and 90%, depending on the area. So those people, what are they going to do if they don't have access to this drug?
Really, really good insights and information. Devi, thank you very much for joining us. Dr. Devi from NYU.